Thank you, Mr. President. Your Excellencies and distinguished delegates, I'm deeply honored to be here today. As I stand before you, I do so not only as a clinician and physician who has spent decades working to end AIDS as a public health threat, but in my home country of Malaysia, both in my home country of Malaysia and internationally, but also as a fellow human being, one who has witnessed firsthand the suffering, resilience, and courage of so many impacted by this epidemic. The story of HIV is at its core a story about humanity. It's about the millions who have perished from a disease that is now entirely preventable and treatable. It is about the millions more who continue to be at risk, not because we lack the scientific tools to fight this epidemic, but because of choices we make as societies. It's about the barriers we erect, the biases we hold, and the policies we enforce that leave so many behind. At the heart of this crisis is a fundamental question. Do we truly believe in the dignity and worth of every person? Because if we do, then we must place human rights, especially the right to health, at the center of our response. This must be our North Star, guiding us as we navigate the complex social, political, and economic factors that shape health crises worldwide. When we apply a human rights lens, we see clearly that this is not just about medicine or policy. It is about justice, about the kind of world we want to build, and about whether we have the courage to stand up for those too often left unheard. The history of the HIV epidemic has taught us this over and over again. Take, for example, the experiences of people who inject drugs, who I work with. In the 1980s and 1990s, countries and cities that embraced harm reduction, meeting people with compassion rather than condemnation, were able to prevent and reverse HIV epidemics. Switzerland, for instance, saw dramatic declines in new infections among people who inject drugs after implementing evidence-based harm reduction approaches. By contrast, countries that clung to punitive approaches, like Malaysia did, my own country, in the early years, experienced devastating HIV epidemics among this community. Only when we shifted course, when we chose to prioritize people's lives over punishment, did we see real progress in Malaysia. This shift required two fundamental changes, both of which remain critical today. First, we had to recognize that criminalization fuels the HIV epidemic, and you've heard some of the data. In countries where drug use is not criminalized, knowledge of HIV status is 15% higher and HIV incidence is 5% lower. Decriminalizing sex work is associated with a 10% higher knowledge of status and a 4.5% lower HIV incidence rate. LGBTQ+ communities in countries without criminalization laws have a 7.6% higher knowledge of status and a 3% lower HIV incidence rate. Now, these numbers represent real people, mothers, fathers, sons, daughters, and friends. They remind us that our policies either save lives or sacrifice them. Second, legal reforms must be backed by robust financing. A change in law without the funding to ensure services are widely available is a hollow victory. Yet today we are failing in this regard. Harm reduction services, for example, remain critically underfunded. Only 2% of people who inject drugs live in countries where access to clean needles and opioid substitution therapy meets UN-recommended levels. This is clearly unacceptable. But perhaps the greatest obstacle we face is stigma, an invisible but deeply corrosive force that isolates, shames, and ultimately kills. Stigma, discrimination, and criminalization continue to keep populations from accessing life-saving services. At least 156 countries criminalize HIV non-disclosure, exposure, or transmission. 169 more criminalize sex work in some form, and 152 criminalize drug use or possession. These laws do not protect anyone. Instead, they drive people underground, making them more vulnerable to infection and less likely to seek treatment. We then must ask ourselves, do we want a world where people are punished for just trying to survive? Or do we want a world where everyone, regardless of who they are or where they come from, has the opportunity to live a healthy, dignified life? Ladies and gentlemen, we know that when human rights are protected, health outcomes improve. Countries with legal protections against discrimination based on sexual orientation, gender identity, and HIV status see higher rates of HIV testing, treatment, and viral suppression. And in places where civil society organizations have the freedom to operate, knowledge of HIV status is nearly 8% higher. These are not abstract statistics. They are proof that when we choose compassion over cruelty, when we invest in people instead of punishing them, we save lives. As was said, we stand at a crossroads. The world is facing multiple crises, pandemics, conflicts, climate change, economic instability. In this moment of uncertainty, it would be very easy to retreat, or to say that our resources are stretched too thin, that we must prioritize other issues. But history has shown us that when we leave people behind, we pay a far greater price. The recent USAID Stop Work order on HIV/AIDS programs has sent shockwaves through the global health community, disrupting critical services that millions rely on. The implications of these decisions extend beyond the communities directly affected. If these programs are defunded and dismantled, the consequences will be felt not just in low and middle-income countries, but across the globe as well. A resurgence of HIV anywhere threatens progress everywhere. The world is at a critical inflection point, with different perspectives on what and who will shape the future. This moment, therefore, demands stronger regional cooperation and coordinated global health strategies to ensure lasting impact. Governments must increase their own commitments to funding and expanding HIV and other public health programs. Civil society organizations, activists, and communities must be given the space and resources to organize and empowered to lead. Now is the time for global solidarity and bold action. We cannot afford to be complacent. Thank you.